Good evening and welcome to today's IAC webinar, Ergonomics, Reducing Work-Related Musculoskeletal Disorders in Cardiac and Vascular Ultrasound. My name is Kelly Baer and I am the Creative Design Manager with Marketing Communications at IAC. Before we begin, I'd like to take a moment to review a few technical matters and let you know how you can participate in today's session. We would like today's webinar to be interactive, so we encourage you to submit questions. To do so, use the Questions tab located on the left side of your screen. Please submit your questions anytime during the webinar, as we will monitor questions throughout the presentation and try to answer as many as possible during the Q&A period. On the left sidebar, please note the polling tab. Today's webinar will feature one live poll question for our audience. Also on the left sidebar, please note the Resources tab. Click this tab for a link to today's handout, a PDF copy of these PowerPoint slides. Select the file name to download the handout. Lastly, in the lower left of the player, please note the Request Support button. If you experience any technical problems during this webinar, click this button. A technical expert will be there to assist you with any issues you may have. For those who like to take notes during the presentation, look to the right of the slides and click the Notes tab. There you will see a white text box where you can take notes on today's webinar. These notes will be emailed to you automatically at the end of the session. To be eligible for the SDMS CME credit, you must be registered, logged into this webinar, then complete the survey. The link to the survey will appear on your screen automatically at the conclusion of the live session and also be available from the IAC webinar portal for 3 business days. If you are viewing this webinar in a group, please be sure you are also individually registered and logged into this webinar on another computer or device so that we have record of your attendance today. Today's presentation is being recorded and will be posted at a later time for on-demand viewing. This webinar is a joint presentation of IAC and SDMS. And now I would like to introduce today's guest presenters, Alicia Armour and Jean White-Melendez. Alicia Armour is the Health Center Administrator at Duke Triangle Heart Associates in Durham, North Carolina. She oversees the cardiology clinic, including diagnostic staff in echocardiology, stress testing, ambulatory monitoring, device clinic, and nuclear testing, as well as nursing, medical assistants, and advanced practice providers. She also serves on the IAC Echocardiography Board of Directors as a representative of ASE. Jean White-Melendez is the Program Director for ESP Ultrasound LLC in the Woodlands, Texas. She is nationally recognized as a premier expert in venous disease and vascular testing and is a frequent lecturer throughout the U.S. She has previously served as an application reviewer and site visitor for IAC vascular testing. Both are true experts in the field, and we are happy to have them with us today. And with that said, I will now turn this webinar over to today's first speaker, Alicia Armour. Alicia?
Thank you very much. All right, we're going to get started. So appreciate the invitation to speak to you all this evening. And our focus, of course, for this lecture is reducing work-related musculoskeletal disorders in cardiac and vascular ultrasound. So both Jeannie and I have no financial disclosures. So the objectives for this evening are identify sources of work-related musculoskeletal disorders, understand the components of an ergonomics policy, understand preventative measures to WRMSD, such as exercise and stretches as it relates to your field, understand ways to minimize them, and best practices to reduce all of these work-related musculoskeletal disorders. So what is a work-related musculoskeletal disorder? These are injuries or disorders of the nerves, muscles, tendons, joints, cartilage, and spinal discs. The work environment and performance of work contribute significantly to the condition, and/or the condition is made worse or persists longer due to work conditions. So there's some important references, and you'll see throughout our slides that we reference pretty much anything we're discussing, but these are two great references for you. As far as our content, I would say the majority of the information we're providing to you tonight come from these two links, and these of course are available on your PowerPoint slides if you download them. And then this is just a quick look at what each of them look like. So this is very nice from the CDC. It's actually specified for sonography, and then the SDMS has done a great job of giving us some information on ways to prevent these injuries as we work. So what are sources of these? Well, it comes from a lot of different capacities. Force is one way. So this is just our exertion of physical effort to perform a task. So if we think about it as it applies to our two modalities, that could be grip force or it could be downward pressure. If you think about it in another capacity for our pediatric counterparts, it might be the force of holding your hand in spots so you don't apply too much pressure. Repetition, that would be performing the same or similar tasks frequently, repetitively, or for an extended period of time without adequate recovery time. And I'm sure all of us can think about areas where we might have some of that repetition involved. And then awkward or sustained postures. So we'll talk a lot tonight about trying to maintain that neutral position. So thinking about flexion and extension of the wrist, shoulder abduction, reaching forward, bending and twisting at the waist, and then bending or rotating at the neck. And one thing I think we don't think as often about is contact pressure. So that's a sustained contact between the body part and an object. So something else to be aware of as we talk through these. So how many sonographers are presenting with symptoms? So it looks like about 72% within 10 years, and then about 45% within 3 years, and then about 15% even within that first 6 months. And so as you can tell from this bar graph here, as we go on in our careers, we have more counterparts that are experiencing some of the symptoms that we'll discuss. So we're trying to lay out for you this evening a prevention roadmap. And so to start, it's with you, and that is your institution ergonomic policy, strength and flexibility, so your own personal work towards those. Then positioning, what's the best position for the patient, your machine, and yourself as the sonographer. Breaks, occasional breaks, how do we work those in, what's realistic, what's not. And then some of our other things that we can control, like our chair, bed, and screen. Is it adjustable, and how is it adjustable so it's appropriate for the majority of our team and ourselves? And this is just an excerpt from our standards with the adult echo standards that they're encouraging us to have, or we're required to have a policy in place to address technical staff safety, comfort, and avoidance of work-related musculoskeletal disorders. So thinking about guidance for these policies, we've laid out here some of the references you could look for as far as information, and it can be very detailed. So just depending on how detailed your facility wants it to be or not, we could get really down to earth on everything, or you can kind of keep a more global perspective. So understanding it's a team approach, so it's up to the employer. There are some vendor responsibilities as far as how our machines are made and their ability to do some of the things that we're going to talk about as far as movement, transducers, our scan chairs, exam tables, a lot of different things. And then as sonographers, we also have responsibility in our ergonomics policy. So let's talk a little bit through some of our employer responsibilities. One thing we'll start with is risk management. So what is the exam time allotted for your facility? What is the follow through for injuries? And even what is the process for injuries, whether you sustain, when you sustain them, and then what you're supposed to do for follow up? what education is provided, such as this webinar this evening, but what is education available on site? Is an ergonomics evaluation possible for your staff or your facility? And then do we provide a survey to you as an employer so that we can track what's going on with our staff as far as any symptoms that they're having, and some of the other components that we'll talk through as far as, you know, these other bullet points here. Equipment, thinking about the machines, what is the flexibility as far as some of the details with each of those systems, as far as our control panel going up and down, and our tilt factors, everything with our monitors, a lot of little pieces in with that. What does your workstation look like? And I think this is something that we don't always think about because we're more focused about the scan itself, but we actually need to focus on our workstations as well. And what is our positioning with that? What do the chairs look like that we're sitting in at with our exam, and then also at the workstation? And then how well do our exam beds work for the exams that we are performing? As far as our exam room, looking at the design and the space, is it appropriate for the work that we're doing? And then what are the workplace conditions, thinking about lighting, temperature, all of these little aspects that play into our day in and day out routines that can affect us as sonographers. What do the protocols look like? What is the length of time for each, you know, considering depending on what you're working towards, and then scheduling itself. So those kind of go a little bit hand in hand, but also should be considered separately. So moving on to our vendor manufacturer responsibility, moving into the ultrasound system. The console adjustable height, so it should be adjustable for everyone from both a standing and a sitting position. Should be 2 or 4 wheel mobility. The transport weight should be 50 pounds or less. And then the base should be functional and unobstructive. As far as our control panels, it should be separate from the monitor. And that, as you can see in some of the machine images I've put down at the bottom of the slide, some examples of how that rotation kind of comes into play there. So it should have horizontal and rotational movements that allows us to set up for neutral scanning. Easy reach for all controls, so we can maintain as much as possible that neutral position, and also try to minimize that repetitive motion and touch points, so everything's at our fingertips and not having to reach too much to the same thing. And then this should be geared towards all scanners, whether you're, you know, depending on modality, whether you're a left-handed scanner or a right-handed scanner. As far as monitors, they should be adjustable separate from the control panel, and it should be adjustable in height and tilt. The design of the monitor arm should allow for single-handed adjustment in all positions, so that you're able to keep your hand in place but move that monitor if necessary, to make it more convenient and less uncomfortable as you're doing your exam. And then all of our systems should have a locking capability for transport. So that more pertains to the control panel and the monitors. And I'll show you an example of that in a little while. Some other responsibilities for our manufacturers and vendors, thinking about those transducers. And luckily, this is always something that they're thinking about from a lot of perspectives, but our transducers should be lightweight and balanced. As much as possible, promote neutral wrist position, thinking about slip resistant, and it should fit most sonographer hand size. And then an appropriate cable length. Thinking through our exam beds, these should also be height adjustable. So again, thinking about the seated sonographer and the standing sonographer, and this again should meet most of our height range for the sonographers that you're working with. It should be safe for patient handling and transfer. You should have adequate clearance for sonographers to get close to the patient themselves. And then there should be adjustable table back, dropouts, and tilt. So thinking through other positions like Trendelenburg. So thinking about all of the adjustments that you would need to make for yourself as you scan, such as with a dropout or tilt, but also for the patient to get the table back up if they're not able to lie completely flat. Side rails for safety purposes, it's important to ensure that those are there for your patients. Scanning chairs, there's a lot that can go into these. They also need to be height adjustable for neutral position for the majority of our scanners. Some features that you want to pay attention to before you invest in these chairs is lumbar support, the seat depth, and the mobility of that seat to be able to go forward and back. Is there a footrest for the seated sonographer or the standing sonographer? What is the height differential as far as going low to high? Is that enough that works with the exam beds you have and the sonographers that are performing the exams? And then a swivel and rotation ability. There should be a form of armrest, and there also needs to be a form of a locking mechanism for safety, again, for us. Some accessories that we use that we don't always think about as part of our ultrasound system and ergonomics are things like wedge supports for our patients. So ensuring that they stay in the position we're asking them to get into and make them comfortable. For ourselves, those anti-fatigue mats for our standing sonographers so that we're not just standing on concrete surface day in and day out. And then some other support devices, even as much as your gel warmers, if you're allowed to use those in your facility. What is our responsibility as a sonographer? So our responsibility is to get as much as we can to a neutral posture. So what do we want to avoid? Prolonged, awkward, or static postures. Uneven seated or standing weight distribution. Even as little as crossing your legs for part of the exam can get you out of that neutral posture. We'll talk more about this later on, but this is just a nice example from a website on how we could set ourselves up appropriately, left-handed cardiac and right-handed abdominal. We need optimization of our work setting. So before you start your exam, setting yourself up for success as far as the ultrasound system itself, positioning it appropriately for how you plan to scan. Does the exam bed you're using go to the heights that you need? And is it set up how you want it for your exam? What is your scan chair like? And is it going to work for the type of scanner you are? And then what, again, is your workstation? Is it set up for you? Is it set up for your colleague and the workstation chair? And then lighting itself, thinking about adequate lighting so that you're able to appropriately optimize your images so we can produce quality images. We also need to think about muscle recovery, and we'll talk more about this when we get into some of the breaks. But just thinking about that time to let our muscles relax. We want to reduce our risk factors for our work-related musculoskeletal disorders. Safe patient handling, this can be a really big one. And I think, hopefully we all have some training that goes along with this, like a falls training and prevention to think about that safe patient handling. But even as you're moving the patient, besides just to the bed, how you're assisting them to roll into from one position to the next, ensuring that you are in a safe position so that you're not compromising your back or your shoulders or your neck. And then ensuring that you report injuries and issues, even if it's minor, it's important for you to inform your supervisor and follow the appropriate things that you have in place so that everyone can track this, but also ensure that you're taken care of. And if it could worsen, so it's important to take care of that at the time that injury may occur, even if it does seem small. And then thinking about education, like today's lecture, are you reaching out for resources to learn more about ways to optimize our work setting? We find a lot of different avenues for education, but hopefully you're getting some of that at your level at your facility as well. And maybe that's through an local ergonomic team for all of the ultrasound departments that you're working with, or maybe it's just one that you all do together where you talk about some interesting articles and what things you could do together. So strength training is something that is encouraged, but not something we always think about as it relates to our jobs. We might think about it more on a personal level, but this really can help us to minimize injury in the workplace. And this is on us as a sonographer. So ideally, we would want to do this 2 times a week, 10 to 15 repetitions twice. To save time, we want to think about exercises that hit multiple muscle groups for one exercise, because we know we're always trying to think about ways to save time. And if you're not somebody who loves to do strength training or exercise, that would be, again, beneficial because you're getting more than one muscle group involved and getting the same benefits out of doing, let's say, 3 exercises in one. You want to focus on the areas that you need based on your specialty. And I think there's probably a lot of overlap, and Jeannie can always pitch in between cardiac and vascular for some of the areas, thinking about importance for the muscles we need to build. But for most sonographers, for the upper body, we have to think about strengthening our back, our chest, our shoulders, your biceps and your triceps. And for the lower body, those big muscle groups, the quadriceps, the hamstrings, and then the calves. And I think some of these are some of the smaller muscle groups like the biceps, triceps, and calves, but they really do contribute to the work that we're doing, especially as we think about those slides that we looked at a little while ago with some of the pressure and those things. Those contribute as much as some of the larger muscle groups. So we've provided a couple of different example exercises. These aren't the ones that we're saying you have to do, but they're just a nice example of some of the ones that you could do that would engage multiple muscle groups. So a dumbbell bent over row would work your back as well as your biceps. You also get some shoulder engagement with that as you would do a bent over row. You could do a free weight dumbbell chest press. Again, that's going to work your chest and your shoulders. It'll also engage the triceps as you extend. Lunges, when done appropriately, can work those quadriceps, hamstrings, and glutes, and the calves as well, because again, this is a multi-joint exercise, so it kind of hits everything. It's also great for stabilization, to think about balance. We've given you an example of a cobra lat pull down, so kind of a lot for our back. So the lat pull down works the mid and upper section of the back. And then as you can see, as that example lifts up, that'll work the low back as well. And that's another area we don't always think about strengthening, but is very important for us as sonographers. A squat curl combines a leg and an arm exercise in one. So again, just trying to think about ways to get the most out of your time. So doing your squat and doing your bicep curl as you squat down. So we're taking care of multiple muscle groups at once. And then just to add, if you wanted to, a little bit more for your triceps, a lying tricep extension. But of course, we've hit the triceps a little bit in some of the other exercises that we've shown you here. So I'm going to turn this over to Jeannie now to go through the stretches, which we would, of course, want to do after we did all that strength training.
That's right. Thank you so much, Alicia. So for my portion, we're going to get a little bit interactive. So the first thing that I always like to think about when teaching how to stay safe as a sonographer is to think about just the same thing you would do in all parts of your life. In order for you to take care of anyone else, you must take care of yourself first. And I think when people get themselves into the field of sonography, it's probably because they have huge hearts and they want to help people. But if you don't help yourself, you're not going to have a long career. Trust me, I'm in year 30. So let's go ahead and take a deep breath in and blow out. Now, we're not going to do the arm stretch because we're going to stay seated in our seat. I'm assuming that you're sitting down. But we can all, even in our seat, just do a few shoulder rolls. Now, the way that you do a shoulder roll is you simply take your shoulders and then act like you're going back towards your ears and then back down. And just roll your shoulders, and it should feel just fantastic. A crossover arm stretch, now that you've worked out those triceps, you want to really make sure that you stretch them out. So you'll just get into the position of this crossover arm stretch, and you'll just hold it for a few seconds until you feel the stretch. Now, you never want to do anything that causes tremendous pain, but you do want to feel that little stretch. Now, the head tilts are awesome. So you simply can put your head down and then back up and down and back up. And then you can also do the hamstring stretch where you'll extend your leg out. You can do all these things in the chair, and you're really going to just press down and really stretch out that hamstring. My favorite stretch is the next one, where we'll go ahead and do the performance, where we take our foot and we put it up on the opposite knee, and then with leaning forward just a little bit. And the more advanced you get with this, you can actually even kind of put a little pressure on that knee that's bent, but you'll probably feel it right away as soon as you lean forward. And then this is a big one, especially for sonographers, and that's getting that wrist flexed. So you just put your hands together, almost as in a prayer position, and you go ahead and say, "Please, employer, give me enough time to do the exam." No kidding. So you press your hands together, and then you'll feel that stretch in your wrist. People that I know also participate in yoga. I particularly love yoga. It's not for everyone, but that can certainly be helpful. But these things that can be done while you're in between patients, and that's what we really want to suggest to you, is that you actively do these types of stretches as you move through your career, taking a little bit of moment for yourself. And as we do all these stretches, a bunch of different techniques here for you to practice and start incorporating. So there'd be nothing better that we'd like to see when we come see you at your facilities, stretching on your breaks. Now, so avoid scanning positions that cause pain. We never want to scan with something that we know is causing pain. That pain is signaling to our brain, this isn't a good position. Wrist flexion, be really careful with how much you grip that transducer, right? So sometimes when we get so methodical about trying to arrive at the proper diagnosis, we really start to use excess pressure on that transducer, almost like a death grip. So just remember, it doesn't take that much to actually hold it, especially since the transducers today are so much lighter than the ones that I grew up with. Now, trunk bending or twisting, that's a big no-no. And the big take-home message on abduction is you don't want to go greater than 30 degrees. Excess force to acquire image, we certainly wouldn't want to do that. So when doing carotid ultrasounds, if you're a person that scans from the head of the bed, you just want to really think about and avoid neck extension and rotation, awkward trunk posture, and that excess abduction. And this is what we're talking about. If you look at the image, 30 degrees or less so this would be a big no-no, and the image on the right would show us the proper angulation that we would want to have. Not a lot of reaching and excessive neck twisting. That would just not be good for us. So as we continue, we think about other things. Remember that force with the transducer. Now in abdomen, in renals, in exams that we have to deal with bowel gas, which is a big bugaboo, a lot of times we'll use that excessive force with our own wrist and hand. And so sometimes it's helpful if you have a bed that adjusts to actually put that bed lower so that you can actually, put more force and straighten your arm out more, and don't put so much tension on your wrist itself. Avoid awkward positions, and then that contact pressure. Really make sure that it's sustained contact pressure between body parts and external objects is good. And that's some fantastic work that was done by Susan Murphy. And you can read that paper at your leisure through SDMS, through the journal. So not so good, leaning, twisting, reaching, shoulder flexion, wrist tension. This is not so good, right? Really extending that arm out and really reaching over cross. What would be great is a straight back, a neutral shoulder, arms supported, and the hands neutral as well. Those cowboy technologists that think they look cool putting that transducer around their neck to keep it out of the way, not so good. Now, this is the beloved exam of all times, the venous insufficiency duplex. And I happen to love this exam. Now, what we would never want to see is this type of work right here, where we're really stretching and reaching. For a venous insufficiency exam, we're going to be standing these patients, right? Because we have gravity working for us in the sense of to challenge those valves. So what can we do? We can get a stand for the patient. And these come in all shapes and sizes, from the fanciest to ones that we even made for our own facility. But you can see, even though she has her head a little bit externally rotated, her arm position is much more neutral, and she's able to get to that popliteal space very easily, and that's right within her eyesight there. So this is what we want to make sure that you don't do. Avoid that hyper abduction greater than 30 degrees, and this is abduction, right? So we remember what shoulder abduction is versus adduction. Okay, so just be real careful to make sure that you do that. And then we want to take breaks. So we want to get coffee, we want to get massages in between every test. No, those are our ideal fantasy breaks. But since we have to live in reality, this is more realistic. Stretching before and after an exam, acquire images, then perform that post-processing measurement. We all have that, whether we do echo or vascular, we all have this ability to do post-processing. One of the things that I would observe with a lot of my students is that even while they're talking to the patient or talking to me, they're keeping their arm in that more strained position while they're communicating, when they could relax and then get the image back. And I think that part of that is because sometimes, when you're first learning, it takes you longer to acquire specific information. But do know ultrasound is so fantastic because we can recreate what we just created previously. So give your shoulder a break, maybe do a couple shoulder rolls, and then get back at it, especially if you have a chatty patient. Now, while you work on your preliminary report, so whether your report is just something that you are typing or it's something that automatically spits out, just switching from transducer time to typing time, you keep those great positions, but those non-repetitive motions will be helpful to you. Now, one thing is to consider ancillary support system. So I ran a vascular lab in Florida here for 20 years, an IDTF. And one of the things that we always did, one, because it was great for the profession to mentor, but we always took sonographer students. Sonographer students are fabulous. They want the transducer time and you need the break. So sonographer students can be really wonderful in helping along the process of finishing patients and that huge the load that you have, whether you're doing echo or vascular. Now, another thing that I never considered until I traveled outside of the United States and found out that outside of the United States, most countries, it's physicians that do the ultrasounds. And guess what? They all have assistants. So I started thinking about that back here in the US. If a laboratory, and this is a financial thing that you could bring back to your facility, if a laboratory has more than 3 technologists, they could increase the amount of exams that they would do and increase the break time for the sonographer by hiring a medical assistant. So think about that, because there's a lot of things that you do that really don't require your super expertise, such as getting a history and physical, even maybe doing that physical exam, such as getting blood pressures and all the chatting with the patient. So you would be allowed to do some stretching, get a little bit time, and maybe you would share this person. Probably everybody would fight over that medical assistant. So just a couple of solutions for some significant problems. Now we look at the finances of this. So, and this is from this wonderful example from SDMS. So if you take a workstation, an ergonomically corrected ultrasound system, so you got a newer system and a table and a chair and all the accessories, the argument would be from any CEO that's doing the, or CFO that's doing the budgeting, wow, that's going to cost us about $200,000. That's just too expensive. But we argue the failure to address the issue is going to cost far more, because the sonographer is going to probably end up missing work. There's going to be medical bills, maybe workers' comp, new staff recruitment, and then temporary staffing issues. So remember, we've got the chair, we've got the bed, and in the case of venous insufficiency, maybe a stool as well to put your patient on, since the patient has to be in the standing position. And if they can't stand, of course, you would just document that. So what are we talking about when we're talking about the equipment? So the equipment has these wonderful, some of the newer pieces have these, almost like a C-arm, where there's adjustments that the screen can make. And even sometimes the keyboard will be adjusted. And so you really want to take a moment to get yourself into the best position possible before you start at. And then every once in a while, do a little self-check. See if you're in the right position. See if you've done good due diligence. So in summary, sources of these types of injuries: force, repetition, awkward, sustained position, contact pressure. Just remember, those are the sources. The components of a policy include the employer's responsibility, the vendor or manufacturing responsibility. So when you're shopping for equipment and you're talking about upgrades, what does each particular vendor or manufacturer offer to you as far as what does their system do? What types of pluses and minuses does each system have? And then the one thing that you absolutely can control is yourself. Remembering to take care of yourself first so that you can take care of others. And then remembering that you can do things before and after that have nothing to do with your actual position, because whatever facility that you're working at today, you might not be working at a few years from now. Right? So it's not necessarily your injuries that you sustain over the long haul of your career aren't necessarily going to be related to where you work. So if you only rely on someone else to fix it for you, then you are not going to get to the root of the problem and the solution. The solution starts really with you, and then you look at others for support. So preventative measures: stretch, strength train, take breaks. Ways to minimize: get a good chair, at the very least, a good chair that swivels and goes up and down is not that expensive. We would argue that that's actually one of the least expensive things. A movable bed is a little bit more. That's another step in the right direction, but nonetheless, we recommend that highly. If you're doing venous insufficiency work, especially if you work in a vein center. You really, because you're doing these day in and day out, and repetition is really an issue. You want to have a stand for your patient, whether that's a hydraulic stand, whether it's a bed that can get you completely to your patient completely to the upright position, or such severe reverse Trendelenburg that you get the hemodynamics that you need. And then what are the best practices? Follow that prevention roadmap. Think about you, think about position, think about breaks, and think about a great chair, bed, and screen. In the words of Walt Disney himself, the way to get started is to quit talking and begin doing. So, with so much gratitude, Alicia and I were so privileged that IAC and SDMS came together for this very important topic to keep us all safe so that we can all have wonderfully long careers. So thank you very much. So Alicia?
Sure. Thank you, Jeannie. So we knew conquering all of the topics that probably you all have been thinking about when you sign up for this would be a challenge in the time allotted. And given that thought process, we are wanting you to fill out our poll question, which is, if the IAC hosts a follow-up webinar on the topic of ergonomics, would you be interested in attending? So please, if you could take a moment now to answer this question, we would love to hear your feedback.
So excellent. Giving everybody a chance to answer.
Looking great so far. It seems like there's a lot of interest.
Excellent. Okay.
Okay, well, at this time, we will begin the Q&A session. From IAC, I'd like to introduce Katie Gibson, our Director of Accreditation for ECHO, and Marge Hutchison, Director of Accreditation for Vascular Testing. Marge and Katie will assist with the Q&A session today. Katie, would you like to start us off?
Absolutely. Thanks, Kelly. Ladies, thank you so much for that fantastic and engaging presentation. And certainly on behalf of IAC and the rest of the audience, I would like to thank you for sharing your insight and expertise this evening. I'm going to direct this first question to Alicia. We had a couple questions about the slide where you showed the vendor, the manufacturer things. Could you clarify what transport weight is, or the console transport weight? Was that in kilograms or pounds? Could you help clarify that?
Sure. Sorry. So I guess I should have made that a little bit more clear. So most of the guidelines that I had reviewed looking into ergonomic policies, it's as far as our systems with a push mechanism should be at most a 50-pound weight. And I know, if you're thinking about when you're searching for jobs, a lot of times in some of the requirements you'll see towards the bottom of a job posting is that you have to have the ability to push something 50 pounds. So I think, employers think about that as well as thinking about it from a vendor perspective. And hopefully, as everything progresses more and more, I think Jeannie could attest to this too. I think our systems are becoming, fortunately, lighter and more compact, and more easy to move from a portability perspective. But if you are expected to move it from and go portably, they don't want it. They encourage it to be 50 pounds or less.
Thank you.
Sure.
Marge,
All
you're
right.
up.
Jeannie,
Yes.
needless to say, a majority of the vascular questions are related to venous reflux testing. Questions about standing up and doing the exams, the length of time they take, the not having the proper ergonomics things, they don't have stands and that sort of thing.
Sure.
You know, what are they supposed to do?
Yeah, so this is such a really hard thing, but this is what I did and I would do. First and foremost, remember, you want to discern whether there's a deep venous thrombosis first anyway. So you can do the entire part of the exam in the reverse Trendelenburg, as far as like image acquisition, your compressions, and even whether or not things are spontaneous and phasic, things like that. It's only when you get to the portion that you're going to want to measure that superficial system, as well as know whether or not there's reflux in either the deep system, the superficial system, or both. So if you, let's say, for instance, now I know that the SVU guidelines, which we really bat to as far as the performance guidelines, which are available to everyone, whether you're an SVU member or not. But of course, if you're an RVT or RVS, or even in radiology doing vascular, you probably want to be an SVU member as well. But nonetheless, there's performance guidelines, and those guidelines give event time increments. The thing is that it's something in the realm of more like almost an hour and a half for a bilateral exam. But the reality is, if you're lucky, your institution, what I would beg for is 60 minutes. So if you were, and that includes, writing reports. Now, I will tell you that a lot of times you'll have to hold to actually write or perfect your report, unless it's a DVT, but you will be able to do the majority of that exam in the reverse Trendelenburg. It's only in the point where you actually have to stand them. So if you do not have a place to stand them, that's one way to counter that. But I would say, the people that are your boss in most of these cases of vein centers, okay, or labs, vascular laboratories that do vein work, the boss is a lot of times a physician. And if you bring a plan to them, one that comes from the place of not, oh, this is just so hard, I don't want to do this, this is just ridiculous, and things like that, the complainy type of plan. If you bring a solution, which is, here's SVU's policy and how many minutes they recommend, and this is based on a lot of research, this is based on how much reimbursement is and all that. Here is, you want an accredited lab, okay, that shows that you have a minimum level, your laboratory has a minimum competency. And so you bring IAC's detailed information, which came out of 30 years in the making of information and gathering all this types of information. Then you take them a middle ground, which is that 60-minute exam. And if they don't want to give you 60 minutes, then you ask for an assistant. Because the other part about doing venous insufficiency is that you're going to also need to augment, whether you go ahead and get a rapid inflator deflator cuff, or you simply have the patient do a dorsiflexion with their foot so that you don't have to reach all the way down to the calf. And this, if you got a medical assistant or a student, they could do the augmentation for you. So things like that are little tools or tricks of the trade. But we provided service to many different types of physicians, thoracic surgeons, vascular surgeons, general surgeons, vein phlebology specialists. And that was always my argument. I came to them with solution as much as I came to them with complaint, because let's be frank about it. Let's be really honest. Nobody, not one employer that carries workers' comp on you wants a workers' comp claim. Okay, so that would be my best information to help you through this.
Great. Thank you, Jeannie.
Sure.
All right, I have another vendor or manufacturer type question. Actually, there's a lot of questions about the best ergonomic chairs. I know you showed a picture of one, and I actually have a personal follow-up question. How do you sit in that chair?
All right, that's a great question, Katie. So it's tough to say that something is the best, right? Because everybody has personal preference, right? And we all know that as we work with a different individual. So my personal preference for one chair might not be your favorite. So you kind of going through the components that Jeannie and I both talked about as far as support. Are you somebody that feels like you want that lumbar support? What do you need an armrest, and how much of an armrest are you looking for? The example I showed you on the slide had a much smaller armrest. Is it something that you can get into multiple positions with? So the chair example I showed allows you to get into multiple positions. So you can sit on it facing forward with the back to your back. You can sit on it sideways, so you're straddling the seat, but your legs are still at that 90-degree angle, and you're, depending on if you wanted your left or right arm resting on the armrest, it would rest on that. You could also sit reverse on that and with your chest against the back itself. There are a lot of different versions that, if you think about some of those seated massage chairs that look like that from a chair perspective, that are out there too. So it all is in what what you can get within your budget and what your sonographers and your team like the most. So for example, at my facility, we had a couple different chairs, and I asked my sonographers, well, how are you using these chairs? Because everyone uses it differently, and do you like these? And so when we looked at, what fit the team the best for everything that we were doing, we came up as a group as to, okay, this is going to fit us for everything, because we offer both echo and vascular here. So it worked well for my vascular sonographer, and it worked well for my cardiac sonographers as well for position. So I would say, shop around. If you search ergonomic chairs, again, this is a great thing that I think has come out and changed over time. Or if you're in a larger institution and you have an ergonomics contact person, most likely they have a way to allow you to try out some of this equipment prior to purchase. And can also give you recommendations on what they think would work for your facility. So I would take all of that into consideration when you're thinking of making that investment. As Jeannie said, when you're thinking about big picture and cost, as you're taking it to your supervisor or the budget team, that is something that you want to think about. Longevity with what you're using. How is it going to be utilized with your staff? Is it good for more than one modality? And is it going to make everybody as comfortable as possible? So that's, I hopefully answers what you all were looking for. I'm happy, of course, to chat offline if someone wanted to get into some more details on that.
Well, thank you. That was a lot of detail.
Oh, great.
Jeannie, we're up again.
Yes.
Boy, I tell you, there are a lot of questions about reflux testing, but I'm going to try to concentrate on some other things. Like people are concerned about portable exams where they have to go to the intensive care unit or whatever place, and they just don't have the room and the equipment. They can't push around their chair with them and all that kind of stuff. Any recommendations on that situation?
Yeah, so one of the things as a vascular sonographer that is kind of tough is if you count up all the different types of tests that we do, and then you add together unilateral, bilateral, which can be an issue, right? Because scanning the right leg versus the left leg is a totally different thing, or the right carotid versus the left side of carotid, especially if you're at the head of the bed, is a different thing. So the different types of positions that you're going to get into, it's literally would be crazy for us to say you you can always scan in this perfect neutral position, right? So the reality is there are going to be situations that you're going to get in. If you go up to an intensive care unit, you're going to have to work around several types of monitors and tubes and all kinds of things. And so there'll be a little bit of finagling that you'll have to do. So you'll just keep in mind the majority of what you can control. Okay, because sometimes some of the situations you won't be able to control. Okay, so the reason that, like, if you're at the top of the bed on a carotid and you're scanning, you're right-handed, how are you going to look at the left side from the top of the bed? Well, what I would recommend that you do is you switch hands. And I know at first it might sound really tough. It might sound like, well, no, I really can only use my right hand, or if you're left-handed, how am I going to look at the right side? But becoming somewhat ambidextrous may in fact be very helpful to you. It took myself, as I went through the first 10 years of my career, I made the comment about the transducer being around the neck is because I used to do that until I was actually at a demo. And for, I think it was SDMS, I was demoing a test and I did that. And a very famous sonographer came up to me and said, Jeannie, and she was about 10 years older than me. She said, don't do that. That pressure from that transducer cord around your neck and then the positions that you get in is just going to add to the tension of your neck. And, I know that she was right. And I adjusted to that. The other thing is learning how to scan with my left hand. I certainly am not left hand dominant. It was a little bit tough for me to do, but it helped me tremendously. The discomfort that I had been feeling in my right shoulder and neck went away as soon as I learned how to use my left hand.
Jeannie, I agree with you. I scan with both hands as well. So depending on what exam presentation you're walking into, whether you're portable or whatever you have to work with. But I think if you think about balance for your body, scanning and switching it out with both arms and both hands will kind of create that balance for both sides of your body. But I think when you're talking about portables, it's even more important because what you mentioned with all the complexities that come going to the bedside, being able to get into a neutral position and having the ability to choose between which hand is really, really helpful.
Great, thank you. I actually have kind of a question that's going to be directed at both of you. We have a lot of questions coming in about the recommended scheduling timeframes for both echo and vascular. Could you tell us what you recommend or what recommendations are out there and published?
Sure. So I can tackle echo first, and then I feel like there's probably a lot more variance with vascular, like under the sun based on the exam type. But for scheduling for echo, the IEC and the ASE recommend allotting for 45 to 60 minutes for your complete study, and then an additional 15 to 30 minutes for complicated studies. And this is from patient encounter to departure. One thing I guess I would advocate for you as a sonographer and an accredited lab is to maybe this is something that you evaluate, right, with your sonographers is, what is our true patient contact time and what is our other time as far as maybe if you're doing preliminary reports or even just getting your patient from the front of your facility into your exam room, what does all of that break down to if you want to really get down to basics. But that is primarily, I would say, what most follow for echo guidelines is the IAC and the AAC guidelines.
Yes, and for vascular, those SVU, you just go to svu.org and then go to practice resources, professional performance guidelines. That will give you not only the detail of what should be included for doing each test, but also how many minutes that they recommend for each one. So I'll take the big ones, the 4 and 93970, which is duplex of the bilateral extremities, is 70 minutes. In reality, we ask for 60, and this is part of that whole negotiation plan that I was telling you about that we did, because 70 minutes, to give 70 minutes for something is a little bit awkward, even in any kind of scheduling platform that you use to schedule people. They recommend 45 for a unilateral, and I would think in reality for a unilateral exam, you're probably going to get 30 minutes. To do it faster than that would, or longer than that would be tough to get them to agree to that. For visceral scanning, they recommend 92, but I would say in reality, you're probably looking at 60 minutes for that as well. So it just depends on your facility, what they'll allow. But if you show these guidelines to your employer and then come up with a solution to what I call reality minutes, you probably can at least beg, borrow, and steal a few minutes here or there. So that might be helpful to you. The other thing is in our lab, when we were in our biggest heyday, had 10 sonographers. And one of the things that would happen sometimes at lunch is sonographers would, and I don't think they meant to be bragging, but they would talk about how quick they did tests. Oh, that only took me 20 minutes. Oh, I can do that in 15 minutes and things like that. And we all have seen this perfect patient that comes in that's already gone to the restroom and they've already done all the things they need to do to be ready for you to do the test. And then you start the exam and the images are great. Everything just falls into place and you do finish a little bit earlier. Okay. I wouldn't necessarily be going around touting about that exam time and how quick you were able to do it, because I will tell you that it is whatever someone sees, whatever a facility sees as far as how much time you're spending, because it is true that time is money, but we would argue that, this in particular is so important to make sure that you get ample time.
Thank you for clarifying that. And I was very excited about your answer to don't brag about your 20-minute scan, because that's a 10 extra minutes that you can to stretch. So
Yeah.
I was happy you said that. Well, I think I'm going to pass it back off to Kelly. Thank you, ladies, and thank you all for submitting such great, thoughtful questions. And I'm really looking forward to scheduling a follow-up session so we can talk more about this. It's so important.
Great. Okay. Well, thanks again, everyone. And a very special thank you to Alicia and Jeannie for their presentation today. Please feel free to contact IAC with any questions that were not answered during the Q&A session. To receive continuing education credit for attending this webinar, please complete the survey. The link to the survey will appear on your screen automatically at the conclusion of the live session, and also be available from the IAC webinar portal for 3 business days. On the left side of the My Account page, you'll click on Webinars, look for the title of this session, Ergonomics, Reducing Work-Related Musculoskeletal Disorders in Cardiac and Vascular Ultrasound. Beneath this title, you will click Review Event. On the left, select the Evaluations tab, then click Take Evaluation to complete the survey. Your certificate will then be emailed to you directly from SDMS, processing within 3 weeks. If you have any questions about the survey, please contact us at webinars@intersocietal.org. Once again, we thank you for joining us today and appreciate your participation.